Welcome to Body Talks Health, where we explore the intricate mysteries of the human body and how to protect it. Your brain is the command center of your existence, requiring a constant stream of oxygen and nutrients to function correctly. A stroke occurs when this vital blood supply to a part of your brain is suddenly interrupted or significantly reduced. Without life-sustaining oxygen and nutrients, brain cells begin to die within minutes, making every single second count for patient survival. This rapid cellular death triggers a cascade of biological failures, potentially leading to lasting brain damage or even fatal consequences. Medical science classifies strokes into two main categories based on the specific underlying cause: ischemic strokes and hemorrhagic strokes. Ischemic strokes are the most common type, accounting for the vast majority of all stroke cases diagnosed around the world. This condition happens when the arteries to your brain become narrowed or blocked, causing severely reduced blood flow known as ischemia. The primary culprit is often a blood clot that forms in arteries, connecting to the brain or within the brain itself. A thrombus is a stationary clot that develops in an area where arteries are already clogged by fatty deposits called plaque. Alternatively, an embolus is a clot or debris that forms elsewhere in the body and travels through the bloodstream to the brain. This traveling mass moves through your blood vessels until it lodges in a narrower brain artery, instantly blocking the flow. Atherosclerosis, or hardening of the arteries, is a major risk factor where fatty deposits build up and restrict proper circulation. While less common than ischemic events, the second type, known as a hemorrhagic stroke, is often more immediately life-threatening. A hemorrhagic stroke occurs when a blood vessel in the brain leaks or ruptures, causing blood to spill into surrounding tissues. This sudden bleeding can occur inside the brain tissue itself or in the space between the brain and the skull covering. Uncontrolled high blood pressure is the most frequent cause, gradually weakening vessel walls until they can no longer withstand the strain. Another common cause is an aneurysm, which is a weak, ballooning spot on an artery wall that can stretch and burst. The accumulating blood creates immense pressure, physically crushing delicate brain cells and disrupting the normal chemical balance required for neural firing. Furthermore, blood is toxic to brain tissue when it is outside the vessels, leading to additional inflammation and rapid cell death. Whether caused by a blockage or a bleed, the result is the destruction of brain tissue due to lack of nourishment. Immediate medical attention is absolutely critical because treatments vary significantly depending on which type of stroke the patient is currently experiencing. For ischemic strokes, doctors may administer powerful clot-busting drugs intravenously to dissolve the blockage and restore blood flow to the brain. In some cases, doctors perform an endovascular procedure, physically removing the clot using a catheter threaded directly through the blood vessels. To prevent future strokes, surgeons might perform a carotid endarterectomy to remove plaque buildup from the arteries running up the neck. Treatment for hemorrhagic stroke focuses on controlling the bleeding and reducing pressure, often requiring emergency surgery to repair the ruptured vessel. Surgeons use advanced techniques like surgical clipping or endovascular coiling to seal off an aneurysm and prevent it from rupturing again. Recovery is a long journey involving physical, speech, and occupational therapy to help the brain relearn skills that were lost. Understanding these mechanisms helps us appreciate the importance of maintaining cardiovascular health through diet, exercise, and regular medical checkups. Thank you for watching this detailed guide on Body Talks Health. Subscribe now to stay informed about your amazing human body.